In this video, I'm going to be talking about some of the common causes of an acute abdomen, and we're going to break it down in the approach of region. We're going to start up in the right upper quadrant and work our way down into the lower abdomen.
For more educational resources, like our medical ID cards, check out medicalbasics.com.
So the first thing is we're going to start off with the right upper quadrant. And the way that I've broken down most of this is into organs and other things that can also cause pain in that region, whether it be referred pain, whether it be things that can just be pain because it's nearby and that we shouldn't ever forget. But also, you always have to keep it very general as well. Even though I've only put these specific causes of pain in the right upper quadrant, remember that pain is very subjective. So pain within the epigastric region or within the umbilical region, it can cause pain in many different locations. So always keep it broad, but this is a good general approach. So the first thing is what type of organs are actually located in the right upper quadrant. Well, we have the liver as well as the gallbladder. And for the liver, we typically think of things like hepatitis. We can also think of other types of infections or abscess. Mass is probably not going to cause acute pain, but it definitely will cause abdominal pain over time. Gallbladder disease, all different types of causes for gallbladder disease, whether it be cholecystitis, choledochocystitis, cholangitis. Any of the causes of gallbladder disease can essentially cause you to have an acute abdomen. Kidney disease, any type of pyelo or any type of colicky type pain. And there's also lung. We can't forget about the lung in regards to pneumonia, because those are things that are very geographically located very similarly. The left upper quadrant is fairly similar. When we look at the other, it's same thing with the kidney as well as the lung. But the other organ that we have on the left side is going to be the spleen. And you can think of it as rupture, either infarct or any type of laceration that can cause splenic damage. Essentially, anything that's going to cause irritation to the perineum is going to cause some type of acute abdomen, whether it be blood or whether it be some type of cause of inflammation. Those are all going to cause pain. The next thing we're going to be looking at is the epigastric region. And so the epigastric region, I put these two as stomach and pancreas, but remember, this can easily be right upper quadrant pain or left upper quadrant pain. But stomach, anything that can cause peptic ulcer disease, gastritis, any type of perforation or ischemia. Pancreas as well, the pancreatitis, or any type of cyst or abscess or any type of rupture. In addition, what we have to think about for the heart, especially in females, is going to be some type of MI as well. In regards to our flanks, and that's what this region is right here, primarily we're going to be thinking about the kidney. Right? The kidney is going to be what we're going to be thinking about in that scenario, whether it be stones, whether it be a UTI, any type of, specifically more so pyelo in terms of our UTI, and any type of hydronephrosis can cause you to have acute abdominal pain, specifically more so in the back, but it can definitely be referred up to the front as well if it's irritated enough. Colon damage as well, any type of mass, perforation, obstruction is going to be causing some type of acute abdominal pain. One thing I want to go over is just the general anatomy. Our colon essentially surrounds the outside, and our intestine is more a small intestines on the inside. We have our ascending colon, our transverse colon, our descending colon, and eventually into our sigmoid colon and then into our rectum. So you can kind of just go by location of where different parts of the colon may cause inflammation as well. So next thing we're going to go to is the umbilical region, which is this essential area right here. Remember, I mentioned that small bowel is there. So any type of infarct, any type of perforation, obstruction. Essentially, these 3 points can be said about any particular organ. You can have infarct, you can have obstruction, you can have perforation to any of those, and all of those would cause acute abdominal pain. The other thing we have to not forget about is our aorta. So any type of abdominal aortic aneurysm, any type of rupture will definitely cause some type of abdominal pain as well. In pediatric patients, we can't forget about other things that can happen within the small bowel, like intussusception or Meckel's diverticulum, or diverticulosis. In right lower quadrant as well as the left lower quadrant, I kind of group these together because they're very similar. The only thing is in the right, obviously you have the appendix, so anything that can have damage to the appendix, and either appendicitis, rupture, things like that. Large bowel, again, just depending on location, either will be the ascending, descending, as well as parts of the sigmoid. And the same thing goes infarct, obstruction, perforation, but now we're also looking at Crohn's as well as diverticulitis as well, specifically more so in the descending descending colon, I would say. Ureter is also another thing that can, if you have stones within the ureter, which is colicky type pain. And then when we're dealing with men and women, we also have to think of a couple other things when we're dealing with the lower abdomen. In females, we always have to think about pregnancy. So any type of ectopic pregnancy can definitely cause pain in this region, especially if you have rupture. Any type of cyst or torsion, pelvic inflammatory disease due to any type of sexually transmitted disease, and potentially any tumor. But remember, just like all the other types of tumors, typically wouldn't cause just acute abdominal pain. It's more of we think of a chronic abdominal pain, but I kind of put it there just in case to just think about other things. In the male patients, we're going to be thinking about things that are going to happen to the testicle or also hernia. So any type of hernia or testicular torsion are going to be things that you would think of, and hopefully not, but testicular rupture as well. So suprapubic region as well. What is in this location? I mentioned the sigmoid colon is there, so any type of infarct, obstruction, perforation, or diverticulitis, as well as the bladder. And this is when we're typically thinking of UTI. Acute abdominal pain, probably less so on your list of what can cause pain there, but you always have to kind of consider what can cause abdominal pain in that location. After trauma, even potentially a rupture could cause pain in that location as well. When we deal with females, we also have to think of the uterus, any type of fibroids, endometriosis, pregnancy or ectopic, as well as potentially tumor or cancer. So hopefully this was a very quick but general approach to at least get you thinking. I think the most important thing is that you always have to think about what's in that general location. I think this is a good general approach to thinking about abdominal pain. And then we always have to think of acute versus chronic. What's higher on our list for acute pain versus what's higher on our list more if it's a chronic type pain, but always keep both into consideration when we're dealing with abdominal pain.
Be sure to check out our website, medicalbasics.com, for more educational resources like our medical ID cards, and don't forget to subscribe to our channel for more tips and lessons.